nut is this? Nasal epinephrine? This is supposed to be Neffy? Nasal, like...
What the nut is this is so valid. So basically that patient got the intranasal topical epinephrine versus the Neffy, which is used for anaphylaxis. Long story short, I guarantee the doctor sent it in wrong. This is what the patient got. If we look at it, it's 1 milligram per mil, and it says vasoconstrictor for topical application. This is what she should have gotten. It's 2 milligrams. The concentration is 2 milligrams per 0.1 mils. These are different concentrations. The provider sends in a prescription, and then the computer just pulls it in like that. Now, I will say, I have never seen this ever dispensed. So what is it used for? Well, it's a vasoconstrictor, so it's likely used for either nasal congestion or epistaxis or nosebleeds. That's what I would guess. See this term topical? That means it doesn't get systemic or in therapeutic concentrations, at least. Let's look at the package insert for Neffy. This is a little graph of plasma concentration. Basically how much of the drug is in your blood. So here we see Neffy, it comes on up here. The epinephrine auto-injector goes shoots on up and then stabilizes. Their end of the curve is similar between the three of these. Epinephrine as a needle syringe, as an auto-injector, and the Neffy intranasal. The difference here that we see is that the auto-injector has a faster onset and peaks faster. The epinephrine auto-injector is still gold standard for anaphylaxis. They have similar levels by about 15 minutes. So Neffy might be good for those who don't like injections. The reason I giggled with this is because when I worked in retail, I saw prescriptions like this all the time where they were entered as like the wrong drug. For example, I was always seeing that metronidazole like topical for rosacea be prescribed when they meant to do like the intravaginal gel. So yeah, the pharmacist should have caught that, because I can probably guess the instructions said for anaphylaxis, you can't use topical for that. Let me tell you this, if you use that, that will not work. But remember, I talk about a lot on my page how pharmacies are understaffed and they don't have the time or the resources to kind of catch these things and follow up on these. But anyway, all you got to do is go back to the pharmacy, just ask for the pharmacist, say that it looks like the provider probably sent in the wrong version and it was filled for that. They'll likely take it back and waste it, and then get a hold of the provider to send in the right one.